Hello everyone, and welcome back to yet another episode here at Healthy.E Nutrition, your number one nutrition content channel. If you're new here, I am your host Dorothy Kathini, a certified and licensed clinical nutritionist under the Kenya Nutritionist and Dietetics Institute. So on our previous episodes, we've talked about introduction of complementary feeding. We've not exhausted that topic yet, but we've touched some bits of it, and we'll be doing that in the subsequent episodes. But on today's episode, I want to address one of the major issues globally when it comes to nutrition, and it is childhood obesity. We will talk about what it is, the indicators of childhood obesity, the contributing factors, and we'll talk about the dangers and how to prevent childhood obesity. So kindly sit back, relax, and enjoy this video. Childhood obesity refers to a malnutritional condition in which a child is overweight for his or her age or height. According to a study conducted by World Health Organization in 2020, 39 million children under the age of 5 years are obese or overweight globally. For children below the age of 5 years, we use standard deviation to classify or to determine whether they are overweight, obese, of normal weight, underweight, or severely underweight. Since we are talking about overweight and obesity, a standard deviation above 2 is considered overweight, whereas a standard deviation above 3 SD is considered obese. Without wasting much time, let's go straight to talking about what are the causes of childhood obesity. Cause number one, and the major cause of childhood obesity, is an imbalance between calorie intake and calorie expenditure. We live in times or in a generation whereby there is a lot of there is an increased consumption of high caloric foods, which are the ultra processed foods, which are very high in sugars and fats. Point number two, which is a major contributing factor or reason or contributing factor to childhood obesity, is lack of physical activity. Nowadays, and because of technology and all that, there is a very decreased physical activity levels within our society, especially among the children, because we've normalized having children play video games, watching movies, Netflix and chill and all that, and we have not encouraged our children to engage in physical activity. Also, another reason that is contributing to decreased physical activity is this urbanization, whereby most schools, they lack enough space to have playground for children while they are at school. So you find even at school, children have very minimal or no physical activity or physical engagement during school times, and most of the time children are at school. When they come back home, we live in times where there is a very high crime rate and the society is very rotten, and you feel like your child is very much unsafe out there, so you'd rather have them inside the house. They just watch TV, they chill, rather than them going outside and play, because you're worried about their security and their safety. So physical inactivity and high calorie intake or consumption of high calorie foods are two of the major contributing factors to childhood obesity. Obviously, there are factors such as genetics. When you talk about genetics now, it's if within your family there is history of obesity, chances are very high that a child in that family might end up being obese. But this one, it can be prevented early enough. So what are the consequences of childhood obesity? Consequence number one is that there is a very increased rate of diseases, especially the non-communicable diseases such as diabetes. We have high blood pressure or the cardiovascular diseases. Also due to the high weight of the child, they are able to get other conditions such as arthritis. So how do we tackle childhood obesity? As we have talked about the causes of childhood obesity, the main point that we need to look into when you are tackling childhood obesity is diet and lifestyle modification. Try and modify your child's diet, reduce on the high caloric foods and have more fiber foods in the diet. You can reduce or make sure that your child doesn't snack on the beverages and unhealthy snacks such as the fries and chips, the burgers. Those are very high calorie foods for a child to be, or for anyone in this matter, to be consuming in one sitting. So try and reduce that. The high fat foods, the candies, the fast foods, the sodas, try and eliminate that in your child's diet. And if you have to give that, just do it once in a while, but it's best if you try and eliminate that in your child's diet. Point number 2 is to work on their physical activity. Make sure that you engage your children in physical activity. Let them go out and play, or you can engage. If you live in an unsafe environment, you can just do stuff like skipping. You can go for walks with your children. Just encourage them to engage in physical activity. And these two things are going to change your child's nutritional status. And when you talk about losing weight and childhood obesity, there are children who are very heavy, or they already have childhood obesity and they are below 2 years of age. And someone would ask me, what do we do with such a child? Because you can't ask them to, you can't limit their food and you can't engage them in physical activity. With this age group, you try and maintain, it's not even up to 2 years, up to around 7 years, you try and maintain the weight where it is. Then as the child grows with age and height, over time, the weight is going to balance with the child's age or height over time. If your child is obese or overweight, or if your child is below the age of 5 years and you don't know if they are obese, overweight or not, please make sure, and I want to emphasize this, please, 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 there's a reason why on the growth and monitoring book, or the mother-child clinic booklet, there is that weight chart up to 5 years. You need to make sure that you take your child for growth and monitoring clinics every other month all the way up to 5 years, because it is during this period that we are able to detect malnutritional cases and find a way of solving them early enough before it gets to a point where it's irreversible. So make sure that you take your child to growth and monitoring clinic. If your child is starting to become overweight and obese, it's going to be noted at that particular point or during those growth and monitoring clinics, and you'll be advised accordingly on what to do not to let your child slip away into childhood obesity and later in life develop the diseases that we've talked about earlier on. So with that said, that is it for today's topic. I hope, guys, you've been able to capture quite a lot and helpful information on this episode. In case you have any question whatsoever, kindly drop it on the comment section. Engage me. Let's engage each other on this topic. Let's help each other develop healthy lifestyle and practices. And for those who have not subscribed to this channel, kindly hit the subscription button, like and share this video. Let's grow this community together. Let's learn together. Let's engage each other, and let's change our nutritional aspect and how we conduct ourselves nutritionally. Thank you for being here. Until next time, see ya.